Hi, I am Dr. Yashavanth, consultant gastroenterologist, Bangalore Institute of Digestive Sciences. So today I am going to talk about management of gastroesophageal reflux disease. So gastroesophageal reflux disease is reflux of contents from stomach into the esophagus, which leads to the symptoms. So it's quite a common entity. All of us would have experienced in our lifetime, but it is problematic when it is persistent. So how are we going to manage? The most important is lifestyle management, in that it is the diet. So in the diet, we have to eat a smaller quantity of food, and we have to eat it slow. It helps in two ways. One, when you eat it slow, it mix with the saliva, which is alkaline, helps in neutralizing the acid. Second, it also prevents the aerophagia, that means the swallowing of air, which might come back as a reflux as belching and carry acid along with it. And we should give a gap of at least 2 to 3 hours between our dinner and sleep. So if we sleep early, the food might get refluxed back. And second thing, when we eat, we should, along with eating small, after eating we should have a small walk in and around, so the gravity helps us to settle the food what we have taken, and it helps in the movement of food from stomach to the intestine. Why is this? Because the GERD happens mainly because of the two basic mechanisms. One, either because of increased acid, lower esophageal valve, which is a valve between the stomach and the esophagus, being lax. Longer the food stays in the stomach, there is a high chance of reflux of food from stomach to the esophagus. Then there are other triggering factors like smoking, either active or passive, and drinking. These also will trigger GERD, so we should avoid this. Next, sleep is one of the important, which is interconnected with the GERD. The poor quality of sleep triggers the GERD, and GERD will disturb or hamper the quality of sleep. As I said, we should give a 2 to 3 hours gap between the dinner and the sleep. And also, when you have reflux symptoms, when you are lying down, make sure your head end is tilted up. Either you can use a wedge pillow, or you can use a brick below the legs on your head end of the cot. So that will elevate, and the gravity assists throughout your sleep. And also, when the sleep is disturbed, your stress might be more, that increases your acid production, and which might trigger or increase the symptoms of GERD. Next, we come to the medication. Sometimes mild GERD can be managed with just lifestyle, or else we'll need a medication. A lot of people use over-the-counter antacids. Antacids are the chemicals, usually they are the bases, which are bound to either aluminum or calcium. When they mix with the acid in the stomach, it gives a immediate symptomatic relief. But the problem with this is, it is a temporary, and it will cause rebound. By reflux, it will cause rebound, increased acid production. So these are only be used for intermittent symptomatic relief. So for longer duration of therapy, this is not recommended. So what we need to use for longer duration, we should use acid suppressing agents, which are H2 blockers, PPI proton pump inhibitors, and we have potassium pump inhibitors, namely vonoprazole. So all these will reduce the acid production and will give you symptomatic relief. But these medication will only give you symptomatic relief, but we have to treat the root cause. Root cause is, if it's increased acid production, either if it's because of stress, that might be various problems. You have to change your perception towards the problem. That can be brought in through a proper counseling, yoga, music, or sports, whichever you prefer, whichever works for you. Sometimes it has to be on a trial and error basis. Next is, if there is some medication you are taking, like analgesics, painkillers, or steroid, that can cause this increased acid. So you have to make sure that if it can be cut down, you have to stop those medications. And thirdly, a subvariant of H. pylori, which causes increased acid, will cause more symptoms with increased acid production. That has to be addressed with H. pylori therapy. Next, if there is a lax valve is the G junction, this part of stomach will usually get pushed up into the chest, and it causes lax valve. So acid get refluxed from stomach up to the esophagus. That will cause the symptoms. It can be temporary during pregnancy. and it will usually recover post pregnancy. But in other cases, they might need a therapy. If they're obese, losing weight and reducing the tummy size, sometimes even reverse it. But or else they will need a therapy. If it's initial stages, we can do a endoscopic therapy. Endoscopic therapy, there are multiple varieties. One is GERD, other is ARMS or ARMA, where we burn the tissue just next to the junction, so it will heal by fibrosis and reduces the valve size. Or if it's a larger one, if there is a large hiatus hernia, then they might require a surgical repair, which is usually a fundoplication, either open or laparoscopically. So this lifestyle treatment is definitely a part, and these PPIs or the medications or surgery or endoscopic therapy has to be tailored to individual patient. So in general, GERD or gastroesophageal reflux disease is quite a common disease. Most often it can be controlled with lifestyle changes and with minimal medication. Very small fraction of patient will require endoscopic therapy or surgery, and stress plays a major role in this, which has to be controlled. Thank you.